Hello, I'm posting another SMA awareness video. Today I'm going to talk about how SMA is diagnosed and what happens once there is a diagnosis. So there are three ways that SMA can be diagnosed. There's prenatal genetic testing and newborn screening, and then clinical uh, presentation symptoms confirmed by genetic testing. So, early diagnosis allows early opportunity for treatment with increased access to prenatal genetic testing. More individuals may be diagnosed before birth. In 2018, the United States FDA um, added SMA to the recommended uniform screening panel, uh, and that is a list of 35 core conditions that all newborns in the U.S. are tested for. Uh, or the FDA recommends newborns be tested for. And then each state determines which of those 35 they will include in the newborn screening. In 2023, or let me back up, 2018 SMA was added to the list, and by 2023, all 50 states have included it in their newborn screening. So, a positive newborn screening for SMA triggers follows up with more genetic testing for confirmation, and a positive or newborn screening allows for early treatment of SMA before the symptoms are present. It is important to note that 5% of individuals with SMA may not be diagnosed through the newborn screening. So that means that 5% of those with SMA would be diagnosed at a later time. It may be 6 months, it may be 2 years, it may be, like in my case, 8 years. It just depends on when the muscle weakness becomes noticeable, or rather, when there is a great decrease in muscle strength. If SMA is suspected and that SMN1 testing shows that there's only one SMN1 gene, if you saw in my previous post, the SMN1 gene is important to the generation of uh, muscle cells. SMA gene sequencing can be ordered by a physician for further testing of SMA. In the absence of newborn screening or lack of a positive newborn screening result, in other words, if a child is not tested or they're one of the 5% that do not receive a positive test, the SMA diagnosis is based on signs and symptoms of muscle weakness. And SMA may be suspected when individuals are noted to be weak or have a delay of or loss of their developmental milestones. So maybe they are able to sit up on their own, and then over time it becomes more difficult and they have to have more support. That would be a sign of decreasing in a milestone, loss of a milestone. In children, these developmental milestones include holding their head up, rolling over, sitting independently, standing, or walking later than they should be. In adolescents and adults, SMA may be suspected when an individual experiences loss of motor function. After a thorough medical history is reviewed, a physical exam is performed, and the health provider should order SMA genetic testing through a blood sample, and an individual may be referred to a neuromuscular specialist. In some cases, it is difficult to diagnose SMA, particularly in the milder forms, because similar symptoms may mimic other disorders, neurological disorders. So let me just quickly tell you the testing that I went through. I was 8, so I remember some of it, but not everything. So with my 8-year-old memory, it was a little traumatic. First, they did a CAT scan, and the thing that I think has changed since in the last 40 years is that when I was being tested, my parents weren't allowed to go back with me. And so nothing was explained to me. I had no idea what was going to happen. And so I remember when I went for the CAT scan, the nurse started to stick this needle in my arm. I'm sure it was some kind of dye or something, I don't know. But she was going to stick this needle in my arm, and I freaked out. I was, I was 8 years old. Nobody explained any of this to me. She just picked up this needle and proceeded to stick it in my arm. And so that was one test. The next one, I'm not exactly sure what it's called, but it's where they insert needles into your muscles and then they send a electric shock to your muscles to see how they react. And again, my parents were not allowed to be in the room. Nothing was explained to me. And I saw these huge needles and again freaked out. And so this was rather traumatic. There was another test where they just touched my muscles and it kind of vibrated. That wasn't all that bad. So those are the 3 tests I remember. And that was done here in Tulsa. And then I was sent to the Children's Hospital in Oklahoma City for further testing. Now, which this was common back then, they wanted to redo all of the tests and see what their results were, rather than taking the results from Tulsa. So knowing that I was going to have to go through something that was already traumatic, was, I freaked out again. And so thankfully, the doctor was nice enough to try to comfort me and explain things, what was going to happen. And he allowed my mom to be in the room. And if they had conducted this test, I'm talking about the electric shocking, where they insert the needles into your muscles and shock your muscles to see how they react. Um, if they had done this the first time, it would have been fine. They had my mom come into the room with me, and she talked to me and kept my attention, and they even blocked my vision of being able to see them injecting the needles into my arms and legs. But I was still very scared, and so um, the doctor did not finish the test. He did enough to say, okay, I confirmed that what Tulsa, the test from Tulsa, was seen. I'm seeing that. So we're just going to go with those results. And I was very grateful for that. One test that the Children's Hospital in Oklahoma City did that Tulsa did not was a muscle biopsy. Now, because my symptoms were mild, um, SMA was not the specific thing that they were testing for. Like I said, sometimes the symptoms mimic other neurological disorders. Polio was one of the things I was being tested for. Possibly some cancers. I don't remember everything. I just remember polio was one of them. And so the last test they did was a muscle biopsy. And that is what led them to, yes, this is SMA, and this is the diagnosis. So, uh, what to expect after a diagnosis? SMA varies within individuals, and this is important to remember when considering the different aspects of care. No two individuals will be exactly the same. Treatment and care plans should be tailored to meet individual needs. Now, when I was diagnosed, there was no treatments, there was no cure. It was just, this is what's going to happen. They told my parents I would be in a wheelchair by the time I was 13. I'd be on a ventilator by the time I was 18. And my life expectancy was early 20s. And the truth of the matter was, from the time I was 8 until I was 18, I actually got better. I got stronger. And when I was in college, I was at the peak of my abilities. There was very little that I could not do. Climbing stairs was still difficult, but manageable. I fell down all the time, but I was able to get up on my own. Um, so, um, really, there was there was improvement rather than progression. And then I kind of plateaued around my mid to late 20s. And and then I started having some difficulties, especially when it was cold outside. Achiness would set in my muscles and pretty much be there all winter. And so I was sent in excruciating pain, just enough to be achy and miserable. And if you've ever been outside in the extreme cold, and that cold kind of sets in your bones and your muscles, and you're kind of achy, that's pretty much what my life was like 24/7 from November until April. But I just kind of lived with it and just kept going. And I would use a cane. I used walking sticks if I knew I was going to be on unlevel ground, regardless of the weather. Um, so that was pretty much my prognosis. Um, and then let's see, around 2010 or 11, um, I started experiencing numbness in my arms and legs, especially my legs. And then 2012, the summer of 2012, that's when excruciating pain. I had to use a walker. I couldn't stand up straight. And I was doing more falling because of the pain. You know, the best way I can explain it is if you've ever broken your leg and you try to stand up, you go right back down to the ground because of the pain. Um, that's kind of an example of what it was like trying to walk and trying to get around. Um, and then by 2013, I was starting to use a wheelchair. Um, I was able to do some walking if I was holding on to somebody or something super stable, um, like a counter or a cabinet or something like that. Um, and then probably around 2017, 2018, um, I stopped being able to do that. If somebody stood me up, I could stand for maybe a minute, and by 2020, I couldn't even do that. So that's pretty much where I am today. There are other things besides my legs and being able to stand or walk that are issues for me, and I'll probably go into that in another post. So, back to if someone was diagnosed today, a lot of that has changed because there are 3 treatments available. So, if these treatments had been available when I was 8 years old, then I probably never would have been lost my ability to walk. Um, my weakness would have never progressed. I would have stayed the same or been stronger if I had been able to receive treatments at 8 years old. So those that are diagnosed now um, may not, or hopefully will not, ever have to go through the loss of those milestones. And being, those that are type 2, those are ones that are never able to walk. Now they probably will be able to walk. Type 1, instead of um, life expectancy being less than 2 years, now could probably live a full normal life and be able to sit up on their own, be able to walk and do all the things that um, abled people, I don't want to say healthy, I want to say abled people can do. Um, I don't want to, the reason why I don't want to use the word healthy is because that would mean if you have SMA, you're unhealthy. And that's not true. It just means you have a disability. A diabetic has to rely on insulin to live. Asthmatics have to have inhalers when they have difficulty breathing. And those are just inconveniences in life. It doesn't mean that they are unhealthy. It just means that they have a something in their life they have to deal with. And that's all SMA is. It's not a death sentence. It's not a burden. It is just something you have to live with. And when have access to these treatments, then you're able to live a better life. So, um, after diagnosis, um, treatment and care plans are developed and put into place. And this is achieved through an interdisciplinary care team. Now, that could be any number of things. It could be a type of therapist, speech therapist, occupational therapist, physical therapist. It could be a pulmonologist if there's breathing issues. It could be orthopedics, um, companies that make wheelchairs, and then, of course, the neurologist. Um, when I would go to clinic, I would usually see the doctor, and sometimes I would see a physical therapist. When I started using my wheelchair, I would see someone that would look at my wheelchair, see if there's any adjustments that needed to be made. And so there's just a number of resources when you go to a clinic that has these teams available. Basically, anybody that you need, nutritionist, social workers, just whatever you need are available at clinic. And that's the MDA clinic, Muscular Dystrophy Association. Um, It is also important to remember that SMA doesn't affect one's ability to think, feel, or learn. Therefore, individuals with SMA have normal cognitive abilities, and participation in any age and developmental appropriate activity is encouraged. And sometimes with adaptations whenever necessary. And those adaptations would be making sure there's a ramp into the building, possibly a table that the height raises or lowers, um, accessible bathrooms. I mean, when it says adaptations, it's not talking about the learning or the thinking part. Adaptations are uh, the environment that the activity is going to take place, the space that the activity is going to take place. So, that is all I have today for diagnosis and what to expect when a diagnosis occurs. Um, in my previous video and today, I mentioned some of the types. Um, in my previous video, I said that the parameters of what is diagnosis is changing. And so um, instead of saying type 1, type 2, type 3, they refer to them as non-sitters, which is type 1, someone that cannot sit without support or assistance. Sitters are those that can sit unassisted but cannot walk, and then walkers are walkers. So, I will be talking more about the 4 types of SMA in my next video, and I hope you have a good day.